Hello everybody, I am Dr. Garima Raghav from Rajiv Gandhi Cancer Institute, Delhi. This video is all about how can we help you. It is very important for all the attendants, relatives and the patients to understand that in order for us to give you a good opinion, we should understand and we should know what materials you already have. You must have shown to your physician or gynecologist, and they must have advised you a battery of tests. Starting with the imaging test, you must be having breast ultrasounds or a mammogram or a MRI. So basically, we need to see all the reports as well as the films, so that once we see the films, we can get it reviewed at our center by the expert radiologist we have. That gives an independent and an individual opinion based on what the films are showing. We need to review the pathological slides or blocks which you might be having of a FNAC or a biopsy which you have undergone outside. We just not see the reports, we have to get them reviewed. Basically, reviewing gives us a more comprehensive outlook of the disease you might be having. We do not decide or make an opinion based just on the reports from outside. Both the reviewing of the imaging and the pathological slides and blogs is mandatory at this hospital. This gives the opinion which is individual, which is independent, and is just not reframing the other doctor's opinion. It comes after a detailed analysis and a detailed review of the reports which you might be carrying. So collection of the material is very critical. Now you might have some difficulties in collecting the materials. So how do you do that? Now, like people who come to us, they have generally gone through the websites, through the Facebook pages, through the Instagram pages. Now, in our case, we have our numbers displayed everywhere. So if you have any difficulty whatsoever, starting from the appointment, what you should get, how you should come, where you should come, you can contact on those numbers which are provided on the pages. We would be really happy to help and very eager to help also. In case of breast cancers or any breast related diseases, the first visit should be to a surgical oncologist. It might be that the surgical oncologist might have a practice dedicated to breast services only, but the surgical oncologist opinion is the first most important thing in the whole journey. After the visit, you should understand that the breast cancer is not a simple disease. It's not that like one size fits all. It's a heterogeneous disease. So basically, we have to tailor the treatment, that is known as personalized treatment, and every patient behaves differently. So the first visit is just to make the patient comfortable, to make the patient understand what is she going through, what is she having, to draw small pictures, to give her small pieces of information so that she can absorb and understand and is not confused about what is going to happen next. She should have some takeaways so that like she can go home and discuss if she needs one like relative or some near and dear ones to discuss with. And then she should be knowing like the pros and cons of whatever procedure she is going to undergo. This is the basis of the relationship we start at the first visit. So the first visit is very important. Feel free to visit. If you have any difficulties in getting appointments or any contact numbers, the contact numbers are freely available on the FB and the Insta pages at our institute's website. Thank you so much.